And on a related note, 82% of parents nationwide say they're worried about sending their kids back to school, which leads us right into our conversation with Dr. Kevin Kavanagh, a retired physician who started United States organization Health Watch USA. And he joins us now. Good morning, Doc.
Good morning, Jack.
Here are the official stats from last night. New daily cases in the U.S., 49,038 with 467 new deaths. Total cases, 4.8 million with more than 158,000 deaths, more than 2.3 million who have now recovered. Total cases worldwide, 18.2 million with more than 692,800 deaths and more than 11.4 million people who have beaten the virus globally. So, give us some good news. Is there any good news?
Well, not too much, other than we know how to defeat the virus, and if people do that, we could be safe at home in a few weeks, safe probably out in the community, provided you're still wearing masks and social distancing. So it's kind of like the old saying, we've seen the enemy and they are us.
Next time I see you, are you also going to be wearing a face shield?
Well, pretty good chance of that. We've talked about wearing goggles for a long time now on the show. Early on, I made the point that just wearing a mask, even if it's an N95, will not provide you adequate protection because you can get the virus on your clothes and in your eyes, and the eyes is a mechanism of spread. So wearing a mask will help. It cuts down your chances of acquiring the virus, but it doesn't give you enough safety that I feel you should not social distance at the same time.
What else should we know this morning?
Well, this is kind of good news, is that we have 3 companies now that have their vaccines that have entered into phase 3 trials. That's the last step, looking at vaccine safety. And they're the AstraZeneca vaccine. That vaccine uses just a spike protein that's inside a virus capsule that's a monkey cold virus. Hopefully that vaccine will let you get the virus by sniffing it rather than a shot. Who knows? But we'll see if it works. And there's the Moderna vaccine and the Pfizer vaccine, which have entered also into clinical trials. Some of these vaccines do cause fever, chills, headache, some muscle pain, so you may get a slight reaction when you get the vaccine. But if the trials look good, we'll at least have that option for people who are very, very high risk and for everybody at some point when enough becomes available.
And then the trick is going to getting people to take that vaccine, which is going to be, in some cases, a hard sell because so many people are anti-vaxxers and they're afraid of vaccine.
Well, and that's the truth. And that's going to be another discussion. And of course, what exactly we talk about, a lot of that's going to depend upon the results of the phase 3 trials. But there are a lot of people that are very anti-science, and they don't believe that, we need to use science to combat this virus. Some have doubts, even now, which is to me unbelievable that this isn't a severe pandemic. And there's also a group of people who are not going to like the vaccine. And that, I think, was really compounded some by the messaging about the vaccine of calling this warp speed and giving the idea that they're rushing to market. And in actuality, they're rushing to get a safe vaccine. And with 3 candidates that are up and running, I feel that there's a lot of competition there and that safety will be one of the major parameters they're looking at. Now, the only question we don't know for sure is how long the vaccine's going to last, because the people aren't going to be followed for 6 months or a year. But they'll at least know what the antibody levels are and that they offer protection to the virus. And so we'll have some good data and at least some estimations on that. So let's wait for the data from the phase 3 trials before making any final decisions.
And the other question that people want to know is how long is this a pandemic going to last, which is a question that no one could answer. But I read somewhere over the weekend that somebody that had some sense about them was saying it could go up to 2 years. Is that, do you think that's possible?
Oh, I think that's very possible, especially because we do not have enough of the populace that has bought into the health professionals' messaging on how to stop this pandemic. And that's just key. The virus isn't going to go away by itself. If we all stay in home and the virus goes downwards and the cases decline, it doesn't mean it's gone away. It's still in the community, So if you come out, you don't socially distance, you go to bars where you're not wearing masks, you're not socially distancing, the virus is just going to come raging back. And that's what we've seen. And we've also seen that our messaging that this virus doesn't respect boundaries is now pretty much accepted by everybody. The cities were hit hard, but now the rural areas are hit just as hard as the cities. And of course, Kentucky, I used as the excellent example, where our major hot spot from the beginning was Warren County and the surrounding counties. Had nothing to do with being in a large city. Where people congregate, if they don't wear masks, if they're not social distancing, it is going to create a petri dish for that virus to grow. So social distancing is good, wearing masks are good. If you do both, that is even better. And we can live safe, but it does mean living a little bit differently.
And it was a week ago today that Governor Beshear put 2-week changes for the restaurants down to 25% occupancy and basically closed the bars. And so we've got one more week to see if there's a good result from that. And then do you think he will rescind that order, or what do you think is going to happen a week from today?
Well, I don't know, but I'm not sure the virus is going to go down much until the surrounding states are controlled. And that's why we need a national policy. I also think, Jack, we really need to change our mindset. It seems like all of our strategies are just getting a lifeline until this virus goes away. Instead, I think we need to change our thinking and really be thinking about how we can live with this virus. And for example, restaurants, I think it would be great to have state grants given to restaurants so they can construct better ventilation, better air cleaning, to construct areas in the outdoors where you can sit in a nice patio and eat your meals. I don't think anybody wants to eat in a parking lot. I think they want to have a little bit of ambience around them. And all of this could be done during this downtime to get ready so that they can then open up safely. Even if the virus doesn't reach very, very low levels or completely go away, you'll have a safer option for getting food.
Dr. Kevin Kavanagh, as always, thank you. We'll talk to you on Wednesday.
All right. Thank you, Jack.